you have more time to get more done, which means you inherently can scale exponentially.
You shouldn't be running your software and managing your software. Your software should help you run the business.
In reality, there is no single company that's going to solve every deep-seated operational challenge in healthcare or in any industry. Don't get left behind. That's where it's right for AI to come in and step in and say, let me help.
This is a conversation series about the people shaping the future of healthcare. These are the leaders who see opportunity where others see obstacles. Each episode highlights experts that understand the complexity of healthcare but choose to act with clarity, purpose, and optimism. We call ourselves co-conspirators because we aren't sitting around waiting for change. We are driving it. Welcome to the co-conspirator track.
When you're talking to a provider about adopting AI for their company, how do you frame the ROI component?
That's an interesting question because I think it all depends upon each individual provider and what their needs are, right? First and foremost. We talked about this kind of earlier. It's not always about headcount reduction. And I think a lot of providers initially jump to that conclusion that, okay, I need to adopt AI so I can reduce headcount. And that's not always the case. That can be, but that isn't always the case, right? There can be instances, for example, hard savings and soft savings calculations, revenue acceleration calculations, and scalability calculations. And so I typically like to break it down into first understanding what are their needs, what are their pain points and challenges, and then let's go from that point. And so from that perspective, hard savings can be anything from maybe they're using older technology that's no longer as necessary that AI can replace. Well, that's not replacing a body. That can just be replacing an outdated technology that's no longer relevant. You can have hard savings by, leveraging a outsourced partner firm, overseas. I won't name any countries, but overseas that maybe have cheaper labor, but still may not necessarily get all the accuracy you're looking for or the speed that you're looking for, where again, AI can eliminate that need because not that you're eliminating your staff, you're eliminating the need for that additional partnership, right? You have revenue acceleration, where in my opinion, AI, because it can make less mistakes than a human, there's two areas. One is well, what about all that revenue you're potentially losing because an employee did not recognize that you have everything you need? And so then they cancel the order or the order never gets fulfilled. Well, you've lost revenue at that point simply because of either maybe it's a training issue, maybe it's a misinterpretation issue, maybe there's been a change in policy that they're unaware of that, again, it causes that lost revenue. You have on the other end of the spectrum, maybe not the lost revenue up front, but there's the lost revenue when you do make errors and mistakes. I typically consider this a protection for your revenue. The healthcare industry is known and is notorious for having audits and denials. In fact, if I'm not mistaken, there was some information that I think around industry standard is about 25% of all initial claims get denied. And that then can lead into recoupments, or it can lead into audits from different payers or from government agencies that then have clawbacks. And then you lose that revenue that you once thought you had, all simply because of mistakes that were made up front that could have been caught by AI. And then you have the scalability portion, right? Which is absolutely essential to keep in mind. Every time there's a problem, whether it be interpreting documentation or requesting more information or handling denials and appeals, takes people away from scaling the business. I don't know of anyone that wouldn't want to throw more towards growth of their business, whether that's more boots on the ground for sales or whether that's new technologies to be able to make things easier for working with physicians or whatnot. So in all cases, there's a scalability issue as well with the resources that you have. And AI helps you identify areas where you can cut down so you can repurpose those resources to allow for scalability. And because AI, like I said earlier, can work 24/7, then you also don't need to worry about, okay, I can only get so much done in an 8-hour day or in a 10 or 12-hour day, which burns out my staff. You have more time to get more done, which means you inherently can scale exponentially because you have the resources that don't stop working for you. So from an ROI perspective, there's many facets that can be looked at. And it's unfortunate that a lot of times, a lot of these businesses think initially, okay, the only value I get is cutting heads. That's just not true. That can be if that's your goal, but that's not the only way to calculate ROI. And I think that there's more valuable ways to calculate the ROI than simply cutting heads.
Yeah, I couldn't agree more. I mean, it's our first episode on the COVID Spirit Track. We had Wayne Van Halem, and then the fourth is Kelly from Wayne Van Halem, and from the Van Halen group. And that's what they do. They partner with HME companies who've been audited and help them navigate that process. And he mentioned that specifically for UPIC auditors, sometimes they deny 100% of their claim, and then it's 100% reversal, which is just wild to me, right? That they're
Crazy.
just so wrong, right? And a lot of that is just the inefficiency of the government and the auditors, but also part of that is, I think one of the most powerful things about adopting AI is instead of your people working on things that are not a human just simply doesn't need to do that. That's just basic logic. Computer program logic can just do automatically, but there are exceptions. There's always exceptions, right? But typically the exceptions are the hardest thing to navigate or hunt down or to fix or to solve. And so those often are the ones that are missed whenever filing for claims and stuff. And so that's what ends up kind of coming back and biting the provider, especially on the audit side, is, oh, well, but you just don't have the time for it, right? And so you're just going to release your team to focus on the stuff that not only helps your business grow and scale, but eliminates the risk component. I think there's an elimination of risk component where your team and your creative problem solvers are solving those truly creative problems, not this day-to-day problems, right? And they get burnt out on the day-to-day. So yeah, I think that's a fantastic point.
You brought up a good piece there, right? Which is, a lot of these providers, they say, okay, well, I just don't have the time to look at this, right? It goes back to that metric, the cost to collect aspect. Is it worth it for me to have my team or myself spend and dedicate the time to collect on this what would be seen as a small or minimal dollar amount, right? I mean, in the DME industry, you've got high dollar ticket items, complex wheelchairs for rehabilitation, and you've got smaller dollar items, nebulizers, which are cheap. And so I see that a lot of times where it's too expensive for me to even appeal it. So I'd rather just write it off. And it's unfortunate that this is one of those few industries where that is even the case. It shouldn't be. We should be trying to get every dollar we earn. And again, this is where AI can help with that, right? Where the cost to collect aspect either becomes negligible or is minimized to the point where, okay, it's affordable enough to attempt to collect every dollar that I've earned. And that's, again, where AI comes in to help with that.
Yeah, absolutely. So let's talk a little bit about, let's shift to maybe the analytics component of AI here. So you obviously have extensive experience in that department, from your banking and then even at Lincare and your position there. So what advice would you give providers on aligning their data strategy with AI to drive better outcomes for their patients or just better visibility for their company?
Yeah, I think it's a great question because I think a lot of times, and this is what I've heard over the years, is I just need data or I just need AI, right? And it's not, you can go out of that approach, but you're most likely going to fail, right? Because that's not the right statement or even question to be asking. The question is why? What are you trying to solve, right? And this is the fundamental question that we even did when we built our analytics and data science teams at Lincare is, okay, what is the objective here? What is the measurable outcome? Because then it changes also the perception and mindset of executive leadership from, okay, I need this just because everyone else is doing it, so I'm going to write it off as a cost, to, okay, I need this because this is an asset to my organization where I can take this information and do something with it. And I commonly refer to data as crude oil. I've said this before in any of my previous staff that hears this, they're going to be like, yeah, he says that all the time. Data is crude oil, right? Inherently, crude oil is, you can't do anything with it. You have to refine it first. And then once you've refined it, then there's multiple applications, but then you have to say, okay, where is it best served? Should I be oiling an engine? Should I be using this to create gasoline? What do I do with this to get the biggest bang for my buck? And building an analytics team and a data strategy starts there. What is my purpose? What am I going to do with this data? Because that defines how you refine the data, right? It also defines what tool sets you're going to use, and it defines your strategy for where you want to get to be, because there's lots of directions you can take. So with that being said, I would first encourage, that's where anyone needs to start. Where is your value? And some of the questions that I've asked is, where are my bottlenecks? And can I solve this with analytics? Is it just simply a descriptive analytics? Do I just need to be informed of the metrics of where I'm at? Is this predictive analytics? Do I need to know where are we going to be with a certain, degree of accuracy and confidence levels? Is it prescriptive analytics? Do I need it to educate me onto what action I should take that gets me to where I want to go? And all of these are different questions. That is the first question. And then you go to the question of, okay, what data do I require to achieve this? What tools will I employ in order to implement this? And then what measurements, what ROIs, what KPIs am I going to use to ensure that I'm getting what I expected out of this? It's a full process. It's not just a technological solution. It is a process in and of itself, right? And kind of with that being said, to go to the second part of your question, well, how do you prepare for AI in the future with this? Well, that should absolutely be in the forefront of anybody's mind. And though AI is still evolving, I feel like every month there's some new big announcement on this new technology that's coming out. Or I mean, we're at Chat GPT 5 already, and they've only been out for a few years, at least publicly, right? We're on Gemini Pro, 4. You're on Anthropic 4 point whatever. There's always something new. It's evolving, and so the other advice I'd say is don't get stuck in, I'm gonna wait until it gets perfected. It's only ever going to evolve. There's never a perfect solution. There's an evolution of products. And so it's important to say, okay, well, where do I need it now? And where are we headed? And then make your decisions off of that. I can't speak to specifics because everyone has different requirements. Everyone sees priorities differently, even within the healthcare industry, depending upon the devices and the way you service and the models you take, whether it be, a stock and bill, a consignment closet approach, as opposed to a direct customer interaction. Those have different challenges. Ultimately, it all stems back down to the first question: why am I doing this, and what am I trying to solve? And then build upon that.
I couldn't agree more. Very early in my career, I realized, especially from a marketing standpoint, there is a ton of data at our disposal, right? And you can really get lost in trying to just present the data, not even necessarily take action but present it. And I remember sitting, I was at an agency at the time in front of a client. I was like, okay, here's some analytics on your website. And I was walking them through it. They're like, okay, why do I care? And I was like, I don't know. I don't know. You're right. And I was like, oh, dang. Okay. It's not about the data. It's about what I'm going to do with the data.
That's
right.
right.
And that's
Actionable insights. That's
right. Actionable data. Yeah, absolutely. So, no, that was a big lesson I learned early on in my career of not every data point matters. Only the ones that matter, right? At the end of the day. And so, and then we have, why not use a tool that helps us automate and collect and present and then take action on that data at the end of the day. So that's great stuff.
Spot on. Fully agree.
So let's go beyond data analytics here. And we've talked about in the previous, in part one of this episode, and then we talked about intake, we've talked about analytics. What other opportunities are you seeing for AI kind of emerge for the HME industry?
Yeah, I think that there's a lot, right? I mean, we've touched a lot on the intake and document collection, and I think that is the glaringly obvious solution that AI can provide, right? But I think it spans beyond that. I think there's a lot of other opportunities, and I'm going to kind of speak more from an agentic perspective, right? And what I mean by an agentic perspective is leveraging AI to take action, and not simply just extraction and interpretation, but take action. Very similar to what Valere is doing with taking action with RPA, making decisions and acting upon those. And I think it's going to be the same here as AI continues to evolve and gets more. I don't want to say traction, that's not the right word. As AI evolves and becomes more sophisticated, which it's already very sophisticated, but I think we still don't even know the extent of where this is all going
Yeah,
to
we're
go.
scratching the surface.
Yeah, that's right. We really are. We're scratching the surface on what I think is going to be a huge transformation across the entire globe, more so than it already has today. I think we're going to see a lot of changes. I think that there can be things, everything from healthcare supply chain automation, being able to help provide better prescriptive analytics based off of your agentic experience to determine what should you keep on stock, what shouldn't you keep on stock. The pricing models. I mean, you see competitive bid coming back with Medicare. I think AI is going to be a huge component in being able to help determine and set pricing that's appropriate, or at least to bid on to hopefully win or gain a contract, right? I think that payers and the insurance agencies, I guarantee they're already employing AI. And I think that that's going to further expand to manage their operations on being able to process claims and being able to process the audits. And as a side note, I think that's also why it's so vital for providers to get in this space. Insurance agencies, they're massive. They've got a lot of money. They've got deep pockets. Don't get left behind where now you are trying to combat AI. It's better to embrace it and have the tools so you can also thrive off of AI. But, that's a whole different segment to go down, right? So I think that these are just a couple areas. Again, and I know I mentioned this before, I don't think AI will replace relationships. I don't think you're going to see robots coming out of cars and delivering an auction concentrator to Mrs. Smith, who's 95 years old, that needs it. I just don't see that happening. I do think that there may be robotic in-care facility aids, but I think you still need that human interaction, right? And so I think that anywhere where there is digital bottlenecks is what I would say is where AI is going to transform it. So if any business is saying, man, this is so painful, the technology is painful, the process is painful, that's where it's ripe for AI to come in and step in and say, let me help.
That's great. So it made me think just our whole discussion here. Someone HME leader that has just kind of been on the outside, and they're going to conferences and there's that AI talk, and they're like, next year, I'm going to look at this one. And, they've been a little hesitant. Maybe they're listening to this podcast right now, and they're probably feeling a little bit overwhelmed. What can they do? What should they start doing to start integrating into this mindset of AI? There's nothing to be scared of here. It's not going to replace you. It's not going to replace your team. Is not going to replace your heart. Why you do what you do. It's just an opportunity to be better. So where do they start? Where does someone like that start?
That's a great question. I think they start first with recognizing where their strengths are and where they need the assistance. I think that's number one. I think everyone is concerned that they've got to go at it alone. I've got to figure out how to implement AI now. I've got to be an AI expert along with being a healthcare expert and being a business owner and being an RCM expert and being a delivery director. No, realize where your strengths are and partner, like what we talked about earlier, right? Partner with those who are the experts and that have the expertise both in healthcare but also the technical expertise, because it goes back down to having the appropriate mentors, right? Whether it's in college or whether it's in sports, you have a coach in sports, you have professors in college. No one expects anyone to just be good and great at everything they do. You have people that help you. I'm not a mechanic. I don't try to fix my own car. I go to a mechanic because they have the expertise and they know what to ask. Okay, well, what's happening? What are the noises you're hearing? When does it occur? So that they can diagnose and create a solution. And so for anybody that's out there listening, or maybe not listening, but hears through the grapevine in some way that about this, it starts with first, find the right partner. Maybe that's Valere Health for helping with RPA and automation. Maybe that's Notable Systems with data extraction and qualification. Maybe that's a different partner. At the end of the day, the starting point is identify you don't need to do it alone. Find the expert that resonates with you, that can guide you along this transformative journey. And it is a transformative journey.
No, that's fantastic, Brian. And you bring up a great point. I love the find a partner, find a partner. I mean, that's what we did at Valere with you guys, right? I remember early on, it was almost like this, okay, we really need to start allocating resources to build a document extraction tool to kind of train an LLM. And then we met you guys and we're like, praise the Lord, we do not have to do this. We can just bring these guys who are just pros, top of the line at it, and let's work together to bring a comprehensive solution there. So can you talk a little bit about that as we close our partnership, Notable Systems and Valere Health, how we're integrating, what are we doing together to help HME and DME providers?
Yeah, I'll touch on a few points that I've seen, and then I honestly I'll turn it back to you because I'm curious to know your thoughts on this same question. But from my perspective, the first thing I'd say is, in reality, there is no single company that's going to solve every deep-seated operational challenge in healthcare or in any industry. Notable Systems, we have our expertise. We are very good. And I would say we are the industry leader in data extraction, interpretation, qualification, and being able to help on those elements. And Valere, you guys do fantastic work with automation, building out those processes that otherwise would be a challenge for a human to do, or repetitive tasks. And so together with kind of those two elements, right, our ability to be able to interpret and extract and your ability to take action and automate makes a huge, powerful combination. The adage I'd give would be that, it's not the best players that win the Super Bowl, it's the best team that wins a Super Bowl. One of us may be the quarterback, one of us is the running back, one of us is the defensive lineman. You need all three to be a stellar team. And that's where Valere and Notable Systems really creates that award-winning Super Bowl championship team, if I could go say so myself.
Yeah, I couldn't agree more, Brian. I think you hit on a big part of our hearts, and I know y'all shared this, and it's, I agree, not one company can do it all. And that's one thing that Dewey saw when he ran his own HME company before he started Valere. Was the problem wasn't necessarily that the solutions weren't out there, but it was that none of them talked to each other, and you couldn't move the data between them. Going back to our data conversation, right? It was a mess. It's chaos from intake all the way to billing, right? It was all these separate platforms, all these separate providers, all really great in their niche, but there was really nothing to move it across seamlessly. And that's the mission of Valere, is to come and be that utility for the company on the RPA, on the automation side, to leverage you guys on the intake, on the document side. And, you have your new PGS, model code and in that solution, and leveraging each and every provider and let them do what they do best, right? At the end of the day, we want you guys to do what you do best. We want your company to do what it does best. And you shouldn't be running your software and managing your software. Your software should help you run the business, right? Your technology should help you run your business. You shouldn't be running your technology, right?
That's right.
We've lost that mindset in the industry of, I need to run this technology to do this and that. No, the technology should be just helping you. It should just make you simply better and make your life easier. But we found a lot of these technologies are, and it's not, I don't think it's necessarily their fault. It's just, again, the complexity of the industry. It becomes more bloat than it becomes helpful. We become dependent on them instead of them lifting us up. And so we should have the flexibility of a provider or a solution that maybe isn't meeting our needs anymore, to be able to not feel that friction that we talked about really early on, in our conversation of, man, that's just, I don't know if I want to switch. That's a lot of work. That's a lot of time. I'm going to train everybody. It shouldn't feel that way. It should be able to go, this ain't working anymore. Let's do this. Obviously this provider has got it taking it to the next step. They're implementing AI. Their UI is something out of, 2025, early 2000s, so we should be able to adopt that as seamlessly as possible. There's always going to be some friction, but it shouldn't be as much. We shouldn't get the sweats when we think about it. Right. So, no, Brian, I couldn't agree more. Well, thank you so much for this just awesome conversation. Of course, love y'all's partnership. We definitely need to do this again. Maybe this is a precursor to a webinar or some other piece of content where we continue to partner to educate, to equip the industry. And really, I know it's y'all's heart, it's our heart, that patients get the care that they need as quickly and efficiently as possible. And that those that are providing the care and putting in the hard work profit from it, that they grow, that they get to change their families' lives and their staff's lives with a business that they love working for and are passionate about every day. And I know that's what you guys are about. It's it's definitely what we're about. So thank you.
No, thank you. I appreciate the opportunity, and I look forward to our continued partnership. I think the healthcare industry is going to be transformed both by Valere and by Notable. So thank you for your time.